And first of all, before starting the lecture, I would like to extend my gratitude and sincere thanks to the College of Pulmonologists and the Candy Society of Medicine to inviting me to deliver this lecture on the novel diagnostic in tuberculosis. I think I did this lecture 1 year ago, and still the topic was the same, but the topic content is going to be differ. That is because basically still we don't have a test to diagnose TB. The very gold standard test to diagnose TB. If a test is a gold standard, it should have some component. It should accurately diagnose the disease, and it has to be very rapid, and also it should be affordable. But unfortunately, even now, when I'm delivering this lecture, still we don't have a test which incorporate these all features. That is why all the time we have to do this lecture on the novel diagnostic, and new development are always happening. So my lecture will be outlined like this. I will basically do an introduction. Then I have to touch on the conventional TB diagnostic methods, because there are a lot of shortcomings, the challenges in conventional TB diagnosis. So there are a lot of shortcomings, the methods we are using, even the method using in other developed countries. Then we have to touch on the main topic, that is the categories of novel diagnostic. And then we have to see in real world what are the actual novel diagnostic tools under the categories of novel diagnostic. And then also I have to touch on the future directions. What are the future predictions for the diagnosis of TB in near future? As Dr. Sachini mentioned, the TB remains a major global health still. It is a very ancient disease. If you go to the human civilization, even at the beginning of human civilization, there are cases, there are evidence that it was there. And as all are aware, it is a primary pathogen of humans, but still we were not able to eradicate the TB globally. Even at this time, when I'm delivering the lecture, few patients are contacting TB. So it is WHO has estimated around 10 million new cases worldwide happening every year, and it is on the rise. So to eradicate TB or to diagnose TB, to treat accurately, it is very essential to have an early accurate diagnosis. That is very critical. The conventional methods are very slow and insensitive, but having said that, I have to say, even with this inherent disadvantages of conventional method, it has played a major role in combating TB. So I'm not disregarding them, or I'm not telling they are not useful, but even today, especially in a low middle income country, still the sputum microscopy plays a major role in combating tuberculosis. But unfortunately, there are a lot of drawbacks. So there are a lot of shortcomings in these conventional methods. And so, there are a lot of new rapid advancement in TB diagnostic, that is related to the molecular diagnosis. It is much improved, but still there are, even in the molecular diagnostics, there are shortcomings. So that is why there is a separate topic on the novel diagnostic. Some of the novel diagnostic are molecular based and some are not, and some are commercially available even now, and most of them are on the pipeline. So As my topic is about the novel diagnostic in TB, I don't have any classification or a slide on any classification on the conventional diagnosis, but you all are aware there are two main conventional diagnostic tests to diagnose acute tuberculosis. Still, it is considered the gold standard. Gold standard is the culture, but unfortunately, the culture can be divided into two. The solid culture and the liquid culture. And the liquid culture is also available in Sri Lanka, but it is only available in a Balisara TB reference laboratory. But unfortunately, usually a solid culture takes 6 to 8 weeks. Then the other most commonly used conventional method is smear microscopy. There are new development in, with the same principle, there are new development in applying the smears microscopies also. But even with the novel development, smears microscopy has a low sensitivity. The most common method of smears microscopy is the acid-fast staining, which is done even in the peripheral small hospitals with the help of a very conventional light microscope. But the new developments are, you can do the same smear microscopy using fluorescence microscopes or lamp microscope, which have yield the sensitivity to some extent, but generally still the comment is valid. Even for those things, the smear microscopy has a low sensitivity. And then the other most important drawbacks regarding this conventional diagnosis is, especially the West countries, they are really concerning about this, the difficulties in diagnosis of HIV-associated tuberculosis and also the extrapulmonary tuberculosis. So if you think about the tuberculosis, why it has been difficult to eradicate, so one reason is it is not only confined to the lung. It has various clinical manifestations. So if you want to diagnose a patient, there should be a tool which is accurate in diagnosing pulmonary tuberculosis as well as extrapulmonary tuberculosis. But unfortunately, to diagnose extrapulmonary tuberculosis, these conventional methods are even less sensitive than diagnosing the pulmonary tuberculosis. And other important factor regarding this is, even to diagnose pulmonary tuberculosis, we are totally rely on, the most convenient sample is sputum, but unfortunately, in some instances, especially at the initial stage of tuberculosis, sputum is also not a good sample. So there are challenges inherited to the pulmonary tuberculosis, and these challenges has grown very rapidly. Basically, the more difficulties are found even more than pulmonary tuberculosis in extrapulmonary tuberculosis. So these challenges are not met by the execution of conventional diagnosis method. And other thing is, the conventional diagnostic methods are somewhat freely available in low middle income countries, but the limited access to quality diagnostic in low resource setting is again another issue. So I have just, you have a comparison chart here. I said even in the conventional diagnostic methods, there were new developments. They are not very new, but still, if you see this chart, still there are, difficulties. So the general term that the culture is the gold standard, but unfortunately culture takes time, still valid for, even if you are applying liquid culture, you can see in the comparison. So usually to diagnose using a solid culture, it takes usually 4 to 8 weeks, but with the liquid culture still it is 1 to 2 weeks. So if you want to have a bedside diagnosis, still the liquid culture is not the gold standard. And also when you are using the MIGIT or the liquid culture systems, the laboratories has to be very sophisticated. You have to basically the lab has to have a very good standard, otherwise higher risk of contamination when you are performing the culture test. there is a high risk of contamination, and also required automated incubators. So applying even some of the advanced conventional method, sometimes in countries like Sri Lanka, it is not very straightforward. That is why this liquid culture is only available in in government sector. It is only available in Varisara Reference Laboratory. So now we will move on to our real topic, that is regarding the categories of the novel diagnostics. So my first slide will be on the categories of novel diagnostics. So as we discussed earlier, there are a lot of drawbacks in the conventional methods. As a result, the molecular testing has been introduced widely to the field of TB, and it is really useful in most of the instances. As you all are aware, in molecular testing, either DNA or RNA is detected. When we talk about tuberculosis, it is the detection of the specific DNA molecules, which is very characteristic to Mycobacterium tuberculosis. And even if you want to detect a drug resistance, the specific gene which produces this resistance, you can detect using molecular testing. And the most fascinating new development is this antigen detection test, which is a very novel technique. There are commercially available lateral flow assays to detect tuberculosis specific antigen, especially from urine, and it is commercially available. And then the most recently developed new testing is host biomarker based test. I will discuss these things in my next slides. And other most important feature is AI based digital imaging analysis and also AI based laboratory diagnostic methods. So then we will see what are the key novel diagnostic available at the moment commercially or at research level. So one of the top priority WHO has given is for next generation molecular testing, or we call the NGS, next generation sequencing, which is commercially available to some extent. And then these urine based lateral flow assays, LAM test, and blood based biomarker assays, which is, I think, will definitely change the direction of diagnosis of pulmonary tuberculosis, and especially extrapulmonary tuberculosis, because at the moment, to diagnose active tuberculosis, we don't use the blood as a main component. Still it is tissues, or still it is the sputum samples. And as you all are aware, you can use blood to diagnose and to apply IGRA testing, but it is mainly for the latent tuberculosis. But to diagnose active tuberculosis, the blood-based biomarkers will be available in the market with a very short time duration. And then I have mentioned to you that the molecular diagnostics play a major role in the diagnosis of tuberculosis, but there are a lot of advanced methods at the moment which have increased the sensitivity and the specificity, and also the turnaround time, which is called the digital PCR and the CRISPR based assays, which are at the research level at the moment. But I think it will definitely change the course of the diagnostic methods in tuberculosis in near future. So there are some, these are some of the tests. The name of commercially available test, but I will skip this slide and go to the next one. So for example of tools, actually the commercial available ones, so the molecular diagnostics, as you all are aware, the Gene Expert is available, and at the moment, even in the base hospitals where the Gene Expert machine is available, we are using Gene Expert Ultra. And also this TrueNet MTB, a product from India. This is also available in the many hospitals in Sri Lanka, because this machine was used to diagnose COVID-19 during the pandemic, and now the TB campaign has taken all these machines, and in some of the hospitals where the gene expert machine is not available, it is there, and this is the point of care PCR testing. And then there is a urine antigen test call. This is done by Abbott, but I don't know whether it is available in Sri Lanka or not. But I don't think it is. It has been using in Sri Lanka, but it is commercially available. And then the risk-level RNA signature, that is host biomarker. Those tests, the last three tests, this CAT4TB or QXR based AI-based chest X-ray tools, I don't think these are available in Sri Lanka, but it is at the research level or to a limited extent using in other countries. So the next generation molecular testing. So earlier, even with the molecular testing, it was the conventional PCR method, which were very cumbersome and time-taking. And sensitivity-wise, it is good, but the specificity-wise, the gold standard still is the culture, but they are accurate and fast. Now we have gone another step ahead. So we have this point of care molecular testing, where the technician, it is very user friendly, and you don't have to, the technician's assistance is very minimal, and you can, it has a very less turnaround time, and you can do lot of number of samples in a day. So the main one are Gene Expert, and as I said before, Gene Expert Ultra detects very low bacterial load, and also TrueNet MTB and Expert MTB XDR. These are available in Sri Lanka. And one thing I want to mention, even with this novel diagnostic testing, always you have to be very careful, because the thing is, all the time, and sometimes when we are using this high sensitive testing, you have to be very careful about the laboratory. We recently had an issue. We were using ultra sensitive Gene Expert kit, and we were doing the both cultures and the Gene Expert were performed using the same safety cabinet. So we got a lot of false positives, because that's why I said sometimes even these novel technologies, if you are not using at the right time with the right technique and the right environment, you will get a lot of other related issues. So now we are digging into the patients who have been treating for last few months after we started to use this Gene Expert Ultra, because there were a lot of false positive cases because the lab has been contaminated with these tiny molecules. So bit on the TB LAM test. So as I said before, in Western countries, the co-infection of tuberculosis and HIV is a big challenge for them. And then the most of these patients having extrapulmonary tuberculosis, so you can't use conventional methods on them. And then, so there are commercially available lateral flow assays to diagnose rapid urine antigen test for HIV positive patients. And there is a new highly sensitive Fuji-LAM test, another lateral flow assay where the silver molecules are being used, which has markedly increased the sensitivity of the testing. And this is very ideal for critically ill patients where the sputum production is very minimal and where the HIV infection is there. But unfortunately, it is not available for sputum. It is only available for urine. And it is a quite easy test. You have to take the urine sample and pre-treat the sample, and then, like the pregnancy test, you just need to incorporate the urine into this cassette, and you will get a rapid results within 25 minutes. And this is the test where the Fuji company has developed an advanced method of a lateral flow assay. Then bit on the blood-based biomarkers. these are at research level. Here, what they are trying to do is, once you get a TB infections, they have found some of the biomarkers produced in the body are unique to Mycobacterium tuberculosis. So some of these biomarkers are RNA molecules. So there are tests being developed to detect these specific RNA molecules from the blood, which is specific for Mycobacterium tuberculosis active infection. And this is, I think, really good, enable non-sputum based diagnosis. And this is also especially promising in children and HIV cases. And other most important thing, I'm not going to touch on this. As a microbiologist, there are a lot of AI supported chest X-ray analysis. So these are some of the platforms where you can analyze many chest X-rays within a short time period. So this is really helpful in enhancing mass screening and triaging, and it is very useful where radiologists are limited. Then the other novel techniques regarding the molecular biology is digital PCRing and CRISPR-PCR based assay, where with these technologies, what they have done, they have increased further the sensitivity and the specificity of molecular testing. So for example, in digital PCRing, what they do is, once you extracted the DNA from the sample, this DNA sample is divided into many small aliquots. And then for each aliquot, for each component, they are performing the PCR testing. So then they do a scoring on this positivity. And for example, if you have around 100 aliquots of PCR DNA from the same sample, and if the positivity is around 80% or 90%, the accuracy is more. And in the other testing, the CRISPR based TB diagnostic, what they do is, the extracted DNA, they divide it into small molecules, and they try to visualize those molecules which is specific for tuberculosis using immunofluorescence method. So the important feature about this CRISPR assay is, you can turn it into a point of care testing. I mean, the initial process is a molecular, but the final product, the detection of the final product, can be done as a point of care assay. So I think this will definitely play a huge role in near future. So what would be the future directions when we are going to come back, or when we want to eradicate tuberculosis? So definitely in near future, it is going to be point of care, decentralized testing, and then, and as you all are aware, the tuberculosis is, I mean, in clinical scenarios, you have to differentiate tuberculosis with other infections as well. So other infections or other diseases. So one of the biggest issue is underdiagnosis of tuberculosis, and also when there is the test is not very accurate, the overdiagnosis is also an issue. The lot of patients I have seen, actually due to the overdiagnosis, they are on these toxic drugs unnecessarily. So in future, definitely multi-pathogen diagnostic molecular panels will be available. And then the integration with mobile health apps, definitely it will happen. And I think there are a lot of tests will be available, affordable and accessible technology. So I think with this new development of AI and everything, the novel diagnostic of tuberculosis has a silver line according to these future direction. So in my conclusion, I will say novel diagnostic are revolutionizing the TB care. They are faster, more sensitive and accessible tests. Combining molecular antigen and biomarkers and AI tools will help in having a right diagnosis, and this will definitely a key to global TB elimination efforts. And the final, my remark would be, the seeing TB faster means saving lives sooner. Thank you very much.